Well, welcome to today's update. It is Saturday, the 18th of April, and thank you for coming back. Now, before we look at some countries in detail today, I want to sort of talk about a few general things first of all. Now, the first point I wanted to make is that basically there's going to be some restrictions on our lives and some social distancing, probably until next year, so things aren't going to get fully back to normal. Now, I'm hoping these lockdowns are going to lift. But it's going to be a while perhaps before we can start shaking hands and hugging and kissing again. And we're probably going to maintain a degree of social distancing, physical distancing, until we have a vaccine. But more news on that in a minute, potentially. So a few notes first of all, a few general points, and then we'll go on and look at some more countries in detail. There's some fascinating trends emerging in the world at the moment. So a few restrictions. Now, this is really quite worrying, actually. It looks like people are not taking healthcare advice when they have conditions other than COVID-19. So I was listening to an interview with a A&E consultant recently, and he was saying people are dying from heart attacks and strokes and other things that can be treated, but they're not seeking medical advice. So very important, if you're ill, seek medical advice. Don't suffer in silence at home. Don't die of other conditions because we happen to have a COVID-19 pandemic. So something to bear in mind. So bear in mind all the other diseases and all the other traumas just carry on. Hopefully there's less traumas because we're less travelling around less, but there's no reason why there should be less heart attacks and strokes and other things like that. Now, another theme that's emerging in a huge way is the problems in care facilities, nursing homes, residential homes, retirement homes. We were worried about this from the very start, where there's a lot of people together, often indoors, often in confined areas, often with the windows closed, and spread of the virus becomes very likely in that situation, usually brought in by staff. And of course, the people in these facilities often have comorbidities. They often are elderly, and therefore the death rate is what you would expect. It's high. Now, another few concerning things. In my country, in the lockdown, there's increased use of alcohol. Now, it's hard to give definitive opinions on this, but anecdotally and from a few things I've looked at, people are using alcohol much more than normal. Especially in the nicer weather, people have been sitting out in their gardens drinking alcohol. Now, alcohol is probably not good for the immune system, and it's not good for social interactions either. So I really would encourage people to think about your alcohol drinking. And there is actually something that's evidence-based here that we know what to do. What you should do if you drink alcohol at all, so you'll notice I'm tarring moderate drinkers with heavy drinkers here. If you drink alcohol at all, what you should do is keep an alcohol diary and record how much you drink on every day. Now, you could just write down the drinks that you had, or you could work it out in the units of alcohol if you like, and then add it up at the end of every week to see how much alcohol you've drank. Now, I've been doing this for over 20 years with student nurses, and many of them, when they add it up, are actually quite surprised by the amount they're accumulatively drinking in the week or in the month. And there's evidence that shows just the sheer awareness of that can reduce drinking by up to about 20%. So I would encourage people who do drink to keep an alcohol diary. Now, this is also terrifying. Rises in domestic violence with people being stuck at home all day. Now, we are in this together, so we have to help each other. And the hardest people to get on with are those that you spend all day with. So just try and be objective and think about the relationships with those in the house with you, or in the flat with you, or whatever it is. Not everyone has a big garden. A lot of people are stuck in small flats, and it's incredibly difficult. And think about your friends. Think about where there might be tensions, and make that phone call. Talk to people. Try and help. You can't go around for a drink. You can't go around for a cup of tea, but you can make that phone call. You can make that Skype call. You can leave the Facebook message. Just interact with people that you think, well, interact with everyone, but especially if you think someone's at risk, then certainly interact with them and try and come alongside. Just show them that other people are there and other people are interested. And also suicide attempts. Again, the same advice really. If anyone, especially people that live alone, are more prone to suicide, especially men. So just bear that in mind and just try and come alongside people that you know and show them that they're not alone. They might be alone in their flat, but they're not alone in life. And that's your job to try and let them realise that. Now, World Health Organization, yes, that one. Now, Dr. Mike Ryan, one of the leading people in the World Health Organization, has said many people don't seroconvert. Many people don't seroconvert. Now, what does he mean by that? Well, you probably know the blood's in two parts. There's the cells and there's the plasma. And the old-fashioned name for the plasma is the serum. So the blood cells are floating in the serum. And when we talk about serology, we're talking about studies that look at the antibodies in the serum of the blood. And when someone's exposed to the virus, that is the antigen, the immune system will respond and they will produce the antibody. And we know they have the antibody because we test it in the serum of the blood. So we call it serology. And when someone seroconverts for a particular infection, they go from being negative for that antibody to being positive for that antibody. So you've probably heard this in the context of HIV. People mention seroconversion, and that can take some time. It can take a few months in the case of HIV, where someone's infected with the human immunodeficiency virus until the antibodies show up in their plasma, in their serum, that process of seroconversion. So Mike Ryan here is talking about COVID-19 and he's saying many people do not seroconvert. In other words, many people who have the infection, Dr. Ryan is saying, don't get the antibody. Now, if that's the case, then that means they wouldn't have immunity. And that's got absolutely massive implications. Now, frustratingly, he didn't say the proportions that don't seroconvert. And confusingly, later on today, I'm going to be looking at a lot of evidence that people do seroconvert, because we'll be looking at studies where people have analysed antibodies in people that have had the infection. I've got two or three examples of that, in fact, to bring you today. So he's saying that some people don't seroconvert. So there you go. It looks like some people don't seroconvert. Now, my suspicion is it would be a small amount of people. I still expect people that have been exposed to this virus to develop antibodies and develop immunity. But here's the World Health Organization saying many people don't. So there we have that. Not much more to say, really. But I will be giving evidence to show that people do seroconvert. And how many don't seroconvert, I don't know, but I do suspect it's going to be the minority. Now, the World Health Organization have excellent epidemiological feelers out around the world, and they're saying there's a 51% increase in cases in Africa. Obviously, we've been concerned about this for a long time on this video, and other people have expressed concerns. And the predictions that we made back in February about care homes, alas, are coming true, and I now fear the predictions about Africa will as well. So the World Health Organization is saying 300,000 deaths possible in Africa. Now, eventually, we would expect this virus to infect 60, 70, 80% of the population. So this virus is going to get round to a lot of us in time, depending on when the vaccines come along. So there's 1.2 billion people in Africa. So that means that 800 million people could be infected. And just a quick back of the envelope calculation. If the case fatality rate in Africa was 0.25% of the population, that would be 3 million people. Now, this is terrifying, of course, and let's hope the World Health Organization know a lot more than I do. But these sort of figures to me do not seem ludicrous. Let's hope I'm missing something fundamental and the World Health Organization knows lots of things I don't. But even so, 300,000 is still a horrendous number of deaths. So am I pessimistic about Africa? Many places in Africa, yes, I am pessimistic at the moment. Let's hope I'm proved wrong. So Kenya, for example, have got 246 cases. I think it's reasonable to assume it's more than that. But good to see that mask wearing is mandated by law. Now, I've got quite a lot of data on Malawi. A friend of mine was a surgeon in Malawi for many, many years, and he sent me a lot of data, but I really apologise, I haven't had time to collate it yet. But at the moment, Malawi's got 17 cases. And I think it's reasonable to assume again that that is an underestimate. And they're arguing about the lockdown, so that doesn't seem to have happened yet. So that is really quite concerning that Malawi still has a lot of social interactions and markets going on. Now, vaccines, of course, are the big hope. Vaccines are the big hope. So what we need to do is we need to make a vaccine. And the vaccine is an inert substance that mimics the virus, makes the immune system think it is the virus, makes the immune system to produce an immune response to the virus, but it's not really the virus, it's part of the virus, or it's a dead version of the virus. So the vaccine is imitating the virus and stimulating the immune system to make antibodies that will be active against the virus, therefore conferring immunity. That's what we're waiting for. Now, there's 70 good quality teams around the world working on vaccines at the moment. Different vaccines. Now, they're not all going to work out, but I think quite a few of them will. So we could end up with a dozen different vaccines for this virus, which would be great. Now, there's a team my government has started up a UK vaccination task force, the United Kingdom government, and they're putting a lot of money into it. And other governments are around the world. I know Israel's working on a vaccine. I know the States are. And pretty well every country is. There's 70 quality teams around the world. But quite a lot of money in my country has gone into Oxford University. And they think they might have a vaccine ready by September. Now, I hope they're right. I think they're being very optimistic. But if that was the case, then that would really be quite transformative, because we have been expecting a vaccine in the summer of 2021. So if they can bring a vaccine forward that quickly, it would be amazing, but it would also be absolutely brilliant. Let's keep an eye on that and hope that the scientists have really got their act together on this, because we need that vaccine. Now, we've mentioned quite a few countries wearing masks, and I showed you some beautiful masks yesterday. And the point about the mask is it stops me breathing and coughing onto you. It's to stop me infecting you. It's not to stop me from getting infected. And the UK are considering facial coverings that would do this. Now, I think a big weakness in the UK at the moment is supermarkets. Everyone has to go shopping for food, and people that are infected will be breathing their virus out. So if everyone wore a mask, then that would guarantee that everyone who went supermarket shopping who was infected was wearing a mask, which is what we want. So I really feel it's time for the UK government to mandate mask wearing in supermarkets and probably other public places as well. And Jerome Adams, the senior doctor in the States, Surgeon General in the States, has demonstrated how to make improvised masks. So it looks like he agrees with that. Now, the other thing that's been fascinating lately is the origins of this virus. Now, there's been quite a few theories about this. Did this virus come from a biological research facility in Wuhan? Now, this wet market, where the virus is believed to have zoonotically originated from animals, happens to be about half a mile away from a Chinese microbiological research facility, which is quite a big coincidence. Now, the answer to the question is I don't know. I don't think anyone knows yet. To me, the weight of evidence still indicates this is a zoonotic infection that has come from bats via animals, which is why I'm very keen that wild animals are not trapped, sold and killed for food in China. Now, even if this virus did turn out to be from a biological research lab, then we still need to stop the wild animal trade in that. Well, firstly, because I believe it's unethical, but secondly as well, because there are untold trillions of other viruses in nature that could potentially infect us. The amount of viruses on the surface of this planet is unimaginable. So the UK government and the American government are actively investigating the virus to see where it came from at the moment. If there is a possibility that it came from a Chinese research laboratory. Now, I haven't commented on this in detail before because we're kind of into conspiracy theories here, but if the American and the British government are both working on it, then that takes it out of the realm of conspiracy theory into the realm of something that's been worked on by the UK and the US government, both highly respectable bodies, of course. So, interesting. Now, I believe my current position is that it will be eventually shown to be zoonotic, but it looks like the UK and the US government have sufficient doubts to work on some scientific programs on that. So let's see about that later. Probably get some definite data on that in the next few weeks. Now, I've actually got lots of country news to bring you today. I've actually there's a few interesting bits and bobs. So I think I've had some upload troubles lately with big videos, so I'm going to cut this now, I think. But just before we do that, I'm just going to show you a couple of interesting things. Now, Benin has kindly sent me his sickness form, which is very kind of him. If I get the right screen, there we go. Yeah, so yesterday we looked at this form that traces the course of the illness. And I think this is a remarkably good idea. Now Brennan is a student in Hong Kong, and he came in from abroad and was given this form. So he put the date when he arrived back in from abroad back into Hong Kong there. And then he monitored the dates as you go along. And this is remarkably useful because it monitors the symptoms. So we see that on day one of his symptoms, the first symptoms that Benin had were abdominal pain and headache. Not exactly typical of COVID-19. Now, I did email Benin to ask him if he'd been tested. And unfortunately, he wasn't tested. So whether this is an episode of COVID-19 or not, we actually have no way of telling. But we do know it can present with abdominal pain and that headache is a common feature. Some people we know have presented with diarrhea. Less common presentation, but it does happen. Now, Benin didn't need to do this, but he's put crosses on all the times when he hasn't had conditions. So that's interesting. So we notice he had headache then and he had headache then. But interesting, we noticed he didn't have a fever. But of course, we noticed that Benin is young, he's 21. So we know that younger people often have a very mild illness. So based on these fever figures, and based on the fact that headache and abdominal pain are common, and he had a headache again then, I don't think there's enough there to say he had COVID-19. But on this day, he had shortness of breath, which is a very indicative feature. So intriguing there. Did Benin have COVID-19 or not? No way to tell. No one in the world can tell by looking at this. But that shortness of breath combined with the abdominal pain and headache is somewhat suspicious. Now, the only way we'll know is if Benin subsequently gets antibody testing. Then we would know if he's had the virus. But the point is, I just think this is remarkably useful. So if you are feeling ill, or someone in your household is feeling ill, look at yesterday's video. There was a list of symptoms. There's more symptoms on yesterday's video than down there. But of course, you can just have a blank table and put your own symptoms in as you get them. But do monitor your fever. If you have an oxygen saturation probe, where's mine? If you have an oxygen, these oxygen saturation probes, if you have one of these things, then do record your oxygen saturations as well. These are only about $20, so I really would advise buying one. I think they're still available. Monitor your oxygen saturations as well if you have that. And you can also monitor your temperature. Well, of course, your temperature, your pulse, your blood pressure, if you can monitor that. Taking pulses would be a good idea. Basically just collect information so that when you can report to a healthcare provider, you've got precise information to give them. And of course, if a few million of us collect this kind of information, this is going to be remarkably useful for research as well. So thanks to Benin for giving us that. And I'm going to do some more country news in a minute, but this is from Andrew, and I think we'll just close with that from Andrew, which is of course a completely self-explanatory. So thanks to Benin for his permission to use his clinical information there. We do appreciate that. And thanks to Andrew for creating this graphic for us.